My topic today is suntan and skin cancer. Skin cancer is the out-of-control growth of abnormal cells in the epidermis, which is the outermost skin layer. The main types of skin cancer are basal cell carcinoma, squamous carcinoma, melanoma, and Merkel cell carcinoma, which is quite rare. The two main causes of skin cancer are the sun's harmful ultraviolet rays and the use of UV tanning bed. Ultraviolet radiation is responsible for several acute and chronic detrimental effects on the human skin, including sunburn, photoaging, and skin cancer. There are two types of UV light, UVA and UVB. UVB represent 5% of UV reaching the Earth, responsible for sunburn, inflammation, and pigmentation and photocarcinogenesis. UVA represents 95% of UV reaching the Earth, contribute to the photoaging such as pigmentation, darkening, and they may be involved in skin carcinogenesis. 76% of melanoma cases attributed to excessive exposure to UV radiation, both natural and artificial sources. More men than women have skin cancer, and 20 times greater in white than blacks have skin cancer. It is important to provide sun protection to children. Research showed a history of 5 or more severe sunburns in adolescents has more than double the risk of developing melanoma. 20% increase of melanoma skin of risk among users of the indoor tanning device compared with non-users, especially for those who start using sunbed before age 35 and more than 10 sessions in lifetime. Recommendations by National Council on Skin Cancer Prevention include reducing sun exposure, seeking shade during the middle of the day hours from 10 a.m. to 4 p.m., wearing wide brimmed hats, sunglasses, sun protective clothing with designed ultraviolet protection factors ranging from 15 to 50, do not burn, avoid indoor tanning bed use, avoid intentional suntan. Generous apply sunscreen to all exposed skins. Use a broad spectrum sunscreen with SPF 30 or higher for protection from UVA and UVB radiation. Apply 15 minutes before going outdoors and reapply every 2 hours. Use extra caution near water, snow, and sand because these surfaces reflect the damaging rays of the sun, which can increase chances of sunburn. Sun protection practices were weakest among youngest adults, persons residing in the Midwest, male, non-Hispanic whites, those who were less educated, smokers, risky drinkers, individuals that had skins that was less sun sensitive. So it is important to provide education to this population as well. There are two types of sunscreen, organic and inorganic. Organic sunscreen using aromatic compounds to absorb UV radiation and convert it to a negligible amount of heat. Inorganic sunscreen are mineral compounds such as zinc oxide to reflect and scatter UV light over a wide range of wavelengths. Sun protective factor measures the sunscreen's ability to protect against a sunburn reaction, which is due primarily to UVB. SPF 15 or higher could decrease the risk of the skin cancer and early skin aging caused by the sun. Broad spectrum sunscreen are generally a combination of sunscreen products that are able to absorb both UVA and UVB radiation. Water resistant means sunscreen will maintain SPF after 40 minutes of swimming or sweating, and very water resistant is after 80 minutes of swimming or sweating. Who will benefit the sunscreen? Everybody will benefit. This is especially useful for individuals who has light skin, who will be more susceptible to the acute sunburn, and who are the person with excessive sun exposure. The benefits of sunscreen include to prevent the development of actinic keratosis and squamous cell carcinoma. Regular use of sunscreen reduces the incidence of melanoma. Sunscreen also can prevent skin changes such as pigmentations and wrinkling due to photoaging. Exposures in childhood is very important as well, as we stated before. History of 5 or more severe sunburns in adolescents will double the risk of developing melanoma. American Academy of Dermatology recommends sunscreen products with SPF 15 are generally recommended for daily use, which may improve the photoprotection compliance. However, in the other settings, in the outdoor activities, choice of sunscreen with SPF 30 or higher, broad spectrum coverage, and water or sweat resistant are recommended. Broad spectrum sunscreen is always preferred, which will cover both UVB and UVA, which should include zinc oxide and or titanium dioxide. How to use sunscreen? Sunscreen should be applied liberally, repeatedly, and to all sun-exposed parts of the skin to provide effective protection. SPF 30 or higher are recommended for individuals performing outdoor work, sports, or recreational activities. SPF 30 or greater will be recommended so to compensate insufficient amount of application. It needs to be applied liberally. 1 teaspoon to face and neck, 1 teaspoon to front torso, 1 teaspoon to back torso, 1 teaspoon to each arm, and 2 teaspoons to each lower extremities. It needs to be applied at least 15 to 30 minutes before sun exposure to allow the formation of a protective film on the skin. Need to wait 10 to 20 minutes before dressing, and need to be reapplied at least every 2 hours. How do we do self-skin examination? We will need a full length of mirror and a handheld mirror. We need to look at the front and the back of the body, arms and the legs, skin folds including axilla, groin, and the toe web spaces, and the sole of the feet. We will look at the symmetric of the skin lesion. The border, is it regular or irregular? Is there any color changes within the same region? And the size of the skin lesion, and enlargement of the evolution of the color, size, and the shape. In summary, everybody will benefit from sun protection. In order to decrease incidence of melanoma, we need to increase sun protection behaviors such as wearing sunscreens, sunglasses, protective clothing, wide-brimmed hat, and avoid the midday sun exposure between 10 a.m. to 4 p.m. and also decrease intentional tanning. Thank you so much.